Ainsdale and I'm a pharmacist from the School of Pharmacy. I just want to tell you a little bit about your product and how it works.
Yep.
So you have an infected nail?
Yeah, the little toe on my left.
Okay. So this product contains amorolifene, which is an antifungal. It'll actually help to penetrate that nail bed and treat the fungus underneath that's actually causing it to look the way it does at the moment.
Okay.
So he's asked you to use this product twice a week. Okay. And this one's a little bit difficult to use, so we'll just open it up and have a look at it.
Okay.
Okay. So the first thing that you want to do is make sure you've got everything ready for when you're actually going to start treating it. There's a little few steps involved.
Okay.
So that's your nail lacquer.
Mm-hmm.
These are little spatulas that you use to apply the product. You've got some nail files in there, and you've got some little swabs as well. So the first thing that you want to do is take one of these little disposable nail files,
Yep.
and if this was your pinky toe, you just file the top of it down.
Oh, okay.
Yeah, so it shouldn't hurt or cause you any discomfort. It's
Yeah.
just to help try and make sure that it'll actually penetrate the nail and help treat the infection.
Okay.
And then once you finish with each of these ones, just throw them in the bin.
Okay, not to reuse them?
No.
Okay.
If you were to accidentally reuse it on another nail, it might spread the infection to the other nail.
Oh, okay.
And there's nothing there for the full cost of the treatment as well.
Okay.
There's no point in trying to
Save
save on
it.
these ones.
Okay.
Okay, so the next thing that we do is use one of these swabs,
Yep.
and it contains alcohol. And you just swab it over the surface of the nail bed.
Yep.
And that just helps to increase the penetration even more of the drug
Okay.
to make sure it treats it.
Okay.
Once you've done that, just make sure you keep onto that swab, we're going to reuse that later. And these are your little reusable applicators. As you can see, there's little holes in here.
Oh, yeah.
Yeah, so when we dip that in, we're actually going to measure a particular dose of the drug.
Okay.
So when you're pulling it out as well, make sure you don't wipe it onto the side of the lip, because it'll actually help to reduce the dose that you're going to be getting.
Okay.
Just pop it in, straight back out,
Yep.
and then just spread it over the entire surface of the nail.
Is it quite thick, like honey, or?
No, it's very thin, like a nail lacquer.
Oh,
Like
okay, like a
thinner or
paint.
something like that.
Oh, okay.
Yeah. So then when you finish with that, you can reuse these. So you just take that little swab that you had before and just swab the little applicator. You
Yep.
can reuse that for next time.
Okay.
And then before you close it, just swab around the outside, just in case there's any contamination. And then make sure you seal it really well afterwards as well.
Okay.
Because it is a lacquer, it might evaporate, and you
Okay.
don't want to lose what you just paid for.
Okay. Yep.
In terms of the side effects that you might notice, at the most you might get some tingling, but it should go away quite shortly, and it doesn't usually cause that much distress. But
Okay.
besides, that's quite safe. Also, in terms of how long you're going to be using it for,
Yep.
he has asked you to use it twice a week,
Yes.
so probably on a Monday and a Thursday or something to that effect.
Okay.
Okay?
Does it matter what time of the day I use it? Before a shower or after a shower? Anything in particular?
If you were to use it after a shower, it would probably be more effective, because
Okay.
the nail will actually be a bit softer and it might help to increase the penetration a bit more. But
Okay.
it's really up to you as long as you do use it twice
Twice
a
a
week.
week. Monday and Thursday. Okay.
Yeah.
Yeah.
Don't be disappointed if it does take time for it to work.
Okay.
So it usually takes about 9 to 12 months
Okay.
for a toenail to regrow all the way through.
Okay.
And you want to make sure you keep up that regime during the meantime.
Okay, so with the nail regrowth, do I wait until the whole nail is completely regrown and looks fine before I stop? Or do I just wait until the nail starts to grow and then cease the treatment?
You continue treatment until it's fully regrown through and all
Okay.
of the old nails come off or been cut off as well.
Okay,
Okay, any other questions with that one, Sam?
No, I think that's everything. Thank
Alright,
you.
Thank you, we'll go process that sales for you.
Okay.